Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. It helps us so much. I'm your host, plastic surgeon Dr. Bruce Hermann, and with me, not as always, is Mr. Robert Dressler.
What's up? Happy
Robert
Friday.
Is one of my best and oldest friends. We've known each other since college, and he is in medical and pharmaceutical sales.
True.
I thought that he would be a great addition to the crew today.
Absolutely.
And thank you for joining us. In the box, we got Travis.
Hey, yo.
And we have an all-guy crew today to talk about topics about women. How terrible is that? We're going to get canceled, I think.
Absolutely.
But that's why I picked some topics that, maybe are a little bit more, male-oriented. So,
I like it.
but yeah. So, Robert, you've done both medical and pharmaceutical sales?
Yeah, a little bit of variety. I've sold advertising, all kinds of good stuff. But pharmaceutical sales in the sense of going in and talking to doctors and write my drug and all of that stuff. So helped with some of the, insurance side of things, as well as hospice. So that was during COVID. Some tough stories.
That was pretty crazy.
Yeah, tough stories, but all good, learning, helping people.
Excellent. Well, I do appreciate you coming on. And so because you're here, I want to talk about a topic that you hear about in the news all the time, and that is just the huge influence that the pharmaceutical industry has on healthcare. And so this segment is about, do drug reps own doctors? And I have a lot of opinions about this. I'm gonna go over some just data that I have, and Robert, please chime in if you
Absolutely.
If I say anything that you think is accurate or inaccurate. So this is data from a few years ago. I couldn't find the most current data, but in 2016, the pharmaceutical industry spent $30 billion with a B dollars in the United States on marketing alone. And of that, $6 billion was for visits to doctor's offices. I assume that's salaries to pay people to go out and make their calls, right?
Right.
And then $13 billion was in samples.
Believable.
And then $1 billion was direct payments. And I think direct payments is, I would assume that's, and you might know this better than I, that's probably more like gifts, like lunches and stuff. That's not cash money, right? Or
So there's a variety of ways that they could have classified it. That was in 2013? 16. Okay, so I can't remember the years, but the Sunshine Act came out.
And we're going to talk about that.
Nice.
Yep.
And so what that direct payment is probably talking about is if you're a speaker, let's say you speak for
that makes
a shoe company because you love their shoes.
Right, then you get a stipend. Okay.
Yes.
Yeah. Okay,
and
that makes perfect sense.
You get paid to go to the training and that sort of thing. So that's more of the direct payments. But
Gotcha.
Yes.
So, and why this is important about the marketing, because some people might say, well, who cares how much drug companies market? Like, they're a private corporation. And I'm really kind of a free, capitalism kind of guy, so I'm going to kind of give my thoughts on that in a little bit. But the reason it's important is because far, far and away, the U.S. has the highest drug prices in the entire world by an enormous amount. And so this brings up some discussion of whether or not this is, a good or bad thing, right? Obviously, people at first glance say, well, that's bad. If the drugs are expensive, that means it costs more for the insurance, which drives up healthcare costs. It costs more for the patient. And so, that's one thing that is definitely negative about how much money is spent. But I always like to be devil's advocate and look at both sides of things. And so one of the good things about, the pharmaceutical industry having that much money is that the U.S. leads in discovery of new drugs by an enormous margin. I mean, a huge margin.
Yes.
In 1 year, and you can correct these facts. I looked these up, so these are from papers I read, but you probably know just as well or better. The U.S. creates 6 times as many new drug patents every year as the nearest second place country.
I believe
it. They do almost half of all drug patents in the entire world.
I believe it.
And so that is one thing that, is a positive of these corporations having this much money is, if we didn't have these pharmaceutical companies creating these drugs, we might not have the next antibiotic for the next bacteria that becomes resistant. We might not have the next cancer drug. My mom has leukemia that 15 or 20 years ago would have killed her in 6 months.
Right.
But there's a new drug out now, and she takes the pill, and she has no side effects.
Wow.
And she's basically in complete remission, and she has been for, I think it's 5 or 6 years now.
Yeah.
So, I mean, these drugs do save people's lives in addition to making people's lives better.
Well, you took some of the words, or some of the things I was going to say is...
I stole your thunder?
You stole my thunder.
That's just like old times.
Absolutely. Anyway. So, a big part of it is that it's like any company. Drug companies and all of that stuff, it's a very hot topic. And a lot of people are on this side or the other.
Yeah, right. And
let's talk about ExxonMobil.
Okay.
So
Let's talk about it.
if they just go down the road and go, okay, we've got all this oil, then we're good and we'll produce it and sell it, but they have to go explore.
Right. And innovate.
Exactly.
And you need money for that. Right.
And that's what I compare it to is like, okay, they're going to hit some dry holes. Pharma's going to do the same.
They're going to lose money on certain things.
Absolutely, but it's different.
Right, and it is like there's two sides of the story because drug prices are stupid expensive, especially when they're under the 13.5-year patent.
Right.
Once they go into generics, then things do get cheaper.
And even speaking to that, so it's not just drug companies. There's so many things in between
like
with
medical
pharmacy.
device.
Well, with pharmacy benefit managers and insurance companies, and there's so many things that it's like, oh, the drug companies get the bad hit because they're charging too much for this drug.
Right, there's middlemen.
Exactly.
Yeah, so everyone's taking a slice of the pie from the factory or from creation to I get the drugs from the pharmacy. Everybody is taking a little bit of a hit.
Yep.
So yeah, I definitely see both sides of that story. Obviously we want to make healthcare as affordable as possible because we want our citizens to be as healthy as possible. But there are some benefits to the drug companies having those bigger budgets, and you can see it clearly in the amount of new drugs that the United States makes. So, but not all doctors are as kind of neutral. I feel like I'm neutral. I don't necessarily love drug companies at all. I really feel kind of ambivalent to them.
Right.
Because I can see both sides of it. But not all doctors are like me. There are many doctors that are just very against the pharmaceutical industry and how much they have influence on doctors. And I had a study, Charles, I think it's just a still picture of that study. You can throw that up. Yeah. So this is a study from just a couple years ago from American Family Physician talking about how physicians should refuse pharmaceutical industry gifts. And it went on to say three points that I pulled out of this were, one, they said doctors should refuse to meet drug reps or medical reps, which I completely disagree with that. They should refuse gifts of any sort, which, I tell you, I'm going to talk about the old days. In nowadays times, you don't really get very much. We get like Chipotle if we let someone come in the office.
It's true.
And it's nice because then my employees get a free lunch.
Absolutely.
It's not just me. I can get free lunch in the hospital. But my employees get a free lunch, so it's a little bit incentive. So I'm not really against that either. And they also said that you should refuse all drug samples. Now, as a surgeon, I don't have. I shouldn't even say that. That's not true. I do have some samples, not necessarily drugs, but more for my wound care patients.
I get some creams and things like that.
I get samples and medications, and I tend to use those for people who either don't have insurance or have problems buying them. So I actually really, really appreciate having samples. And the article went on to say, oh, well, people will say they give them to those without insurance. That's not true. It's been true for me everywhere I've ever been as long as I've been in medicine that we use samples for mostly, not all the time, but mostly we use them for people who don't have insurance or that kind of coverage.
Absolutely. And I've always talked about samples as being kind of that gap. I used to sell a nose spray, and some people wouldn't want to go invest into it or buy it or whatever until they try it.
Right.
But as well, that patient is in your office in primary care or somewhere else, and they're suffering, and it may be diabetes or whatever. Well, after you send the script in, it's got to go through the insurance. The pharmacy has to
it takes time. This is a stopgap.
So why not use that sample for that? And insurance or no insurance.
I'm all for it.
But
Now,
consider it a bribe? No way.
I will say, I don't know, when did you start this industry? Because I know you didn't start
It's about 2013.
Okay,
so about 10, 12 years.
So I've been in this game since around
Been a while.
2000. Yeah.
Yes.
Okay. So I know I'm ancient, but
Experienced.
So I will tell you that the 2000s and before was the wild. It was the Wild West.
I've heard great stories.
I mean, I as a resident got taken on a trip by one of the companies. Now it was for a conference, but they paid for my airfare, they paid for my hotel, they took us out to dinner every night. I mean, I'm a resident doctor. I'm nobody, but they saw as an investment in the future.
Absolutely.
I saw them, and they would also take people out and do like inappropriate things. Take people to places that
I've heard stories.
I mean, just unbelievable things that I saw happen.
Yep.
In the 2000s. And I never saw like a lot of direct payment type stuff, but the amount of money that they spent was just almost obscene.
Absolutely.
And I do think that certainly could influence people. I mean, a little bit.
Yeah, you don't think it does, but at the end of the day,
When it was that lavish.
It was.
Yeah, it was crazy.
I never got to experience those things, I'll say.
Yeah.
I mean, when I came in, the pharma code was signed. I couldn't give a doctor a pen.
Yeah, without documentation.
Yeah,
right?
no, I couldn't. We didn't have them. Like
they
when
wouldn't
I
give you-
started, which, like I say, I mean, 20 years ago, 25 years ago seems ancient, but yeah, I've heard stories about trips. I remember an attorney told us a story in training about if these doctors wrote this one HIV drug, then they would send them to this conference in Cannes, France.
Oh my gosh.
Well, that's how we got all the rules, but I agree with them.
Yeah.
So it's that whole I want to teach you about this drug, but I'm not trying to get in your pocket or your patients or anything like that.
Yeah.
So,
well, things changed obviously from the Wild West to today, and you mentioned it earlier, and that was the Physician Payment Sunshine Act that was 2010 that came through the Affordable Care Act.
yes.
And so that was a big thing that went through. I didn't really realize it at the time because I don't have quite as much interaction with reps as a lot of doctors who have high volume practices. But this Sunshine Act of 2010 increased the transparencies of gifts made by pharmaceutical companies to docs, and this is a searchable thing. And it really kind of put a little bit of brakes on the lavish spending.
Yes.
Which, I don't think that that's a bad thing. It was pretty crazy in the 2000s when I was doing it, and I'm sure it was even crazier in the 80s and 90s.
Absolutely.
But this did cause a significant decrease in the amount of spending. Well, it decreased interactions with reps and doctors by about 14%, and also a decrease in samples and a decrease in spending.
Yeah.
So, my take on this, like everything, I like to see every side, and generally I'm a very kind of centrist person. I do think that probably the 80s and 90s drug pharmaceutical spending on docs was probably not a good thing, because when they were spending that much money, they probably were influencing behavior.
Absolutely.
Do I think that happens today because someone brings me Chipotle? No, I just don't. I mean, no one's going to influence me with that. With something like that. I mean, I can get a free lunch anywhere. I pay for my own lunch.
Right.
So, and maybe it's just because I'm in the specialty I am. Maybe there are people spending more money out there, but you don't hear about it, and so I don't think it's quite as prevalent. But on the other hand, I don't like what the article was talking about not letting doctors meet reps. I mean, I think that is a good thing.
I agree. So one of the things I always tried to do was their time is valuable. Your time is valuable. If you're a primary care or a family doctor, you're seeing, 30 patients, 40 patients. When do you have time to study new drugs and compare this one to that one? And the big one, cost.
Yep.
Docs would ask me, well, how is this covered? Well, that's a multi-layered issue, but letting them know how their patients can get it, but as well just, hey, these are the simple things.
Right. It just makes everything easier when you have a representative helping you through the process, like learning about it. And all good doctors should go back and check their work. And I do that all the time when reps come to me. the first thing I always say is show me the study. Show
Absolutely.
me. If you don't have a study, I'm not interested. If you have a study about your product, I'll at least look at it and see if it's something that might be applicable.
Yep. I had a doctor that didn't want to see any glossies. He told me no glossies because he had been on boards and he had
So tell
developed those.
people what glossies are.
So
I know
a
what you're talking
glossy
about, but
is basically something you go in that has the study and it's very specific and it's this much better and it's this much faster
It's the
and
bullet
that sort
point,
of thing.
right?
It's the bullet point, but
Yeah.
it's all pretty. And it is good.
I don't want it to be pretty, darn it.
Exactly. And so he told me, he was like, no glossies, don't bring me a glossy. And I fully respected that. He's been an allergist for
He
years.
wants papers, like paper. What did he want?
He just wanted the
to talk.
relationship
Oh,
to
I
talk,
see. Okay,
a little
alright.
bit of that.
Yeah, very good.
So he gave me some pushback one day, and it was fine. It was more of a resource for him that was showing all the drugs in the category. We ended up being really good friends.
Yeah.
He took me down to his wine cellar below his office.
He had a
and
wine cellar below his office.
He made the wine below his office. He was like a chemist, really cool.
My gosh, I'm like lagging behind here.
Yeah, exactly.
Well, you did send me one clip when we were talking
Yeah.
about this yesterday, and so
Absolutely.
This is another kind of angle of the pharmaceutical spending that I think is worth at least talking about for a minute. And this is from the Joe Rogan show. So, Travis, can you roll that clip for
Big
us?
fan.
Well, here's the first problem. Advertising for pharmaceutical drugs on television.
Yeah.
Advertising for pharmaceutical drugs is illegal in every country in the world except for New Zealand and the United States.
Wow.
'Cause you shouldn't be able to influence people to want to take these drugs that they may or may not need. That should be entirely a conversation between you and your healthcare provider. Someone should be giving you an educated understanding of what the pros and cons are, and this is why I think you need this, and this is why you should take that.
Yeah.
It shouldn't be you coming to your doctor. Ask your doctor if la 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 is right for you. Do you have days or blah blah blah? Do you have that?
Yeah.
Well, la 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 is for you. But it's crazy. It's like everybody wants to be happy. So if the problem with advertising is, I mean, it's one thing if you're advertising for a nice pair of shoes or something like that. I don't find any problem with that. But when it comes to things like drugs, and especially when it comes to antidepressants, and when it comes to these things that they're advertising constantly on television, constantly on YouTube, just constantly, the amount of money is so extraordinary that they put into advertising. It's such a huge chunk of the advertising budgets of television shows.
It's every show.
Every show.
So, Joe Rogan talking about that he has a little bit of beef with the fact that pharmaceutical companies can advertise on TV. So, I'll just go ahead and give my opinion on that. I disagree with him a little bit. Like I said, I'm kind of a free capitalism kind of guy. If they want to advertise, let them advertise. I think that his fear that someone's going to go to a doctor's office and get put on this drug just because they asked for it is probably unfounded. It may get the person to inquire about it to their doctor, but doctors, at least all the doctors that I have historically worked with, have a pretty strict regimen for how they prescribe drugs.
Absolutely.
And
Absolutely.
so I don't think it's a bad thing though, because it does get people thinking about their health care. And when someone sees an ad on TV for a certain drug, that might stimulate them to go to their doctors, which
Right.
we're always trying to get people to go to their doctors. That's
True.
one of the reasons that some of our metrics are not as good as other countries is because we're not great about going to the doctor.
True.
Americans are independent. We're stubborn. We think we know it all. I mean, and we don't go to the doctor. But I think that has the potential to get people into their doctors, at least start a conversation about whatever issue that they've seen on the TV. And I just don't feel. I'll tell you. And granted, I'm not a primary care doctor, but 0 times in the 20 years I've been practicing medicine has someone come into me and said, "Hey, I saw this ad on TV for this drug. Will you give it to me?" And granted, I don't prescribe a ton of drugs, but there are other products, medical things that are advertised.
Right.
So I don't know. What are your thoughts on that?
So supposedly it does happen a lot.
Really? Okay. Everything I said is wrong.
No,
Sorry.
no. But I think it just depends. I'm with you on the free market.
Yeah.
There's one other country in the world that allows it.
New Zealand.
Boom, winner.
I only know that because I watched.
And I love Rogan. I wish Rogan would hear this.
Rogan's
and
coming
comment.
on next week.
No, he's not.
Rogan.
I wish he would. That'd be awesome.
That would
I'd
be
be
fun.
here. I'm a big fan.
Are you?
Yeah.
I don't know if I've ever watched one of his episodes. Is it really good? Do I need to watch it?
Yeah, man, he's got all kinds of good people on, but he's fair and he'll listen.
Yeah, he's
but
pretty
he'll do
balanced.
his research.
Oh,
you
that's
know,
good.
and
That's-
so
he's like us.
exactly, you know what you're talking about. But yeah, I think it's good. The key is a patient having those right expectations, kind of what you've talked about with plastic surgery. Like, not really going to get that, but this
Yeah.
is what you can expect.
Well, and that's where the doctor needs to come in
Absolutely.
and do their job, which is say, okay, this drug is appropriate for you for these reasons, or it's not appropriate for these reasons. And I feel like most doctors do that. I don't think there's a...
Do you have a lot of patients come in with their list or WebMD? I guess it's different.
Oh, dude,
but
yes. Like with questions?
Yeah.
Yes. I mean, I do very frequently, and I love that. I've talked about this many times that I really almost insist on my patients being informed.
Yeah.
And so when I'm talking about surgeries, like I inform them, but I love when they kind of pre-inform themselves.
Absolutely.
And I always ask, okay, did we cover all the things that you brought? And usually, because I've done these consults 100 million times,
Right.
they're like, yeah, you answered all my questions. Or sometimes they'll come up with a new question. I'm like, oh, that's a
Yeah,
good one. So,
that's a good one.
so, Travis, weigh in on the. I mean, this is probably not in your wheelhouse, but any thoughts? You've been kind of quiet in there. I'm gonna really hit you up for the next 2 segments, so I hope you're ready.
Absolutely.
But I mean, what do you think? Like, I don't know. Any thoughts on the pharmaceutical industry?
You know what's funny?
I've
I've never personally walked into a doctor's office that I've had and requested a certain medicine that I see on TV. Most times, I'm not gonna lie, whenever I see a medicine on TV, it kind of makes me not want that medicine for whatever reason. I don't know why.
It's because if they have to advertise for it, it probably sucks, right?
And I think they tell you like all the side effects and stuff like that on the commercial.
If you
up
take
front.
this, your head might fall off. You'll
Right.
get herpes,
Is it
rabies.
Is it that
implosion.
bathtub in the middle of the nowhere thing that kind of scares you? The Cialis?
It might be.
Like, wait a minute.
Not
Nobody takes a
Cialis.
bath like that. What's up?
We went straight to Cialis. This turned left.
It's so funny because like they show these commercials and the people are all like having the best time of their life,
Right.
like,
Exactly.
like
And-
out in the field flying a
Yeah.
kite, and you're just like,
Thanks.
I ain't doing that. I mean, will I
Right.
do that if I take this drug? Maybe I do need it. I don't know.
That's what Rogan was talking about too. It's
Exactly.
like this. I mean, really? You
Yeah, I don't
so-
know.
Right.
I don't. I just tune out when I see a drug commercial. I'm just like my brain just shuts off, and
Right. Facts.
I feel like it's almost like work. So I don't want to like have to think about drugs when I'm at home. Like, man, it's just like a work thing. So
Interesting conversation though.
yeah, it is. So all right, guys, listen. If you're out there, let me know what you think about. Does the pharmaceutical industry have too much power in the United States? Do they spend too much money? I mean, there are definitely pros and cons. It does drive up the price of drugs, which drives up the price of healthcare, but as I said, it does lead to a lot of industry. It leads to a lot of innovation and new drugs, which for me have saved my mom's life. So, and I'm not just saying all these things because of that, but I mean it is a true fact. So, let me know what you think about the pharmaceutical industry. Sometimes they're bad guys, sometimes they're heroes. Here, we're just talking honestly about it.
Absolutely.
Just having an honest
Be
chat.
real.
Be real. Are you on Be Real?
No, I'm not.
Do you guys know what Be Real is?
Yes, I know.
Travis, do you know what Be Real is?
I know a rapper named Be Real from back in the day, but that's about it.
No,
Nice.
like the app Be Real. Do you know
Oh,
what
I
it
no,
is?
know.
no, I do
So
not.
yes.
Are you
My-
on Be Real?
No, my niece and nephew do it. It
I'm on
pops
it.
up automatically.
Yeah,
you
you
take a picture of yourself and then where you are.
Yep, but you
and
have
it
2
has
minutes to
go.
do it.
Yeah.
That's it. Yeah,
And
my daughter Danica got me on it, and I really enjoy it. And it's funny because I'm on Be Real. Hit me up if you're on Be Real. I'll be your friend out there. I'm on Be Real, and like 90% of my friends are my daughter's friends. And I have 2 real friends. That's it. There's an anesthesiologist I know that has it,
Nice.
and one of the scrub techs.
Nice.
And so I need more adult friends on Be Real.
Absolutely.
So if you feel like Be Real, hit me up. I can't remember my name. I think it's Bruce Hermann or something, or BF Hermann. I can't remember. All right.